I think by far the most exciting data for lung cancer was the survival analysis of the FLORA study. This was a randomized phase 3 study of patients with EGFR mutation positive non-small cell lung cancer, either exon 19 or exon 21. We already knew the progression-free survival results from that study, which was the primary endpoint, in that osimertinib provided improved progression-free survival compared to previous generation or first-generation EGFR TKIs. At this year's ESMO, Dr. Ramalingam updated the results and now presented overall survival results, which showed that there was an overall survival advantage observed with osimertinib. I think this is a landmark result in that this is the first time in solid tumor oncology that we have demonstrated that one targeted agent improves survival compared to a previous generation of targeted agents. And I think this is a very, very meaningful impact in the management of these group of lung cancer patients. The other data set that was presented at this year's ESMO was again in the presidential symposium, like the first study, which was the final overall survival results from the Checkmate 227. This study is unique in that it is the first study evaluating combination IO therapy compared to chemotherapy. What was presented by Dr. Solange Peters is that the combination did improve survival in patients with tumors that had a PD-L1 expression of greater than or equal to 1%. I don't know if this necessarily replaces the current standard of chemotherapy plus immunotherapy, but what I think is valuable about the results of the study is that now we have another option. So if there were patients who were unwilling to be treated with chemotherapy, one could potentially, once FDA approves this, and I anticipate that the results of this study would lead to an approval, that we have another option other than chemotherapy and immunotherapy to use a dual chemotherapy, immunotherapy combination.